Okay, hi. Very good evening once again. Hope I'm audible now. I checked my video also. I mean, the same one which we have uploaded. Hope I'm audible. Yeah, the same one which we have done previously, right? So I've just checked out. It seems to be fine. Audio seems to be fine. But the problem which I've observed is when we're not using mic, because all my recorded videos I use a mic system, so it will be clearly audible. But without mic, so you'll need to have these earphones if you're watching the live session through your mobile. If it's laptop, I'm sure you can increase the volume and it will be comparatively be audible. But if you're watching the live session through mobile, I'm sure you have to use some earphones. Only then you can focus because we're having some distance between the cam mic and myself. So it won't be that clear compared to those recorded videos which we usually have in our e-classes, right? So next time onwards, when you're using your mobile, make sure that you have your earphones also. If in case you're having problem or trouble in listening to the audio which is coming out in the process, right? Yeah. Hi everyone. Once again, a very good evening. So we'll start with a textbook discussion. Hope you have this. Okay, okay, Bernice. It wasn't like that before, but I'm not sure like what's wrong because the entire setting has been the same. We haven't changed it much. Yeah, right. Okay. Hi, Ben. So previously, I didn't have this chance to say hi to each one of you individually because I felt like we had a lot to discuss. So I had to skip that formality. But now again, Bernice, Prithvi, Neetu, Gina, hi. Hi, Shivam. Yeah, hi, Saida, Mini. Yes, Shivam, I'll definitely tell something. Yes, Abhishek, hi. Hi, Sirisha. Yes, Neetu. Hi, Pragati. Very good evening. Yes, Bernice. Ramesh, hi. Hi, Upasana. Hi, Pooja. Ashina, today isn't your day, right? Hi, Akash. Okay, now you feel that the audio quality is fine because I'm more near to the cam. Maybe that's the reason why you're able to feel that. Hi, Datri. Can I implement this technique in UK as well? Which technique are you talking about, Datri? Upasana, is it necessary to take coaching for NEET examination? Okay, Upasana, just drop a mail at proudtobedentist@gmail.com. We shall have a discussion over there, right? So this live session will focus only on this textbook discussion, right? So if you have any general questions, drop a mail at proudtobedentist@gmail.com. I'll reply over there. Okay. Yes, Datri, of course you can. It's all customized. The techniques which we use, they're all customized. Okay. Right. So we'll proceed with textbook discussion. So as we have been discussing different principal techniques for root canal shaping. So broadly, there are three techniques. Like we have this crown down technique, a step back technique, and a hybrid technique, which is a combination. So to outline all these techniques, step back techniques, I mean, page 314 of the latest edition, which I think I'm following, 13th edition, right? So we have this step back technique, which includes conventional technique as well as passive step back. And then we have this crown down technique and its modifications like crown down pressureless, double flare technique, which was given by Faber, and we have this balanced force technique. And also we have this hybrid technique. So if you observe table 13.7, they are given various authors, the names of various authors who have proposed these different techniques. So to summarize all that, step back serial preparation was given by Wien and Schilder, as we discussed previously. Anti-curvature filing proposed by Abo Ras and Jastrap. Crown down pressureless technique given by Marshall and Papin. Step down technique proposed by Goring. Double flare Fava, balanced force Ronne and Sabala. And we have this passive step back proposed by Turabin Ejab, right? So these are the summary of various techniques proposed by different authors altogether. And before we go into the details of each technique, right? So we'll just go into the details of each technique and see what important points we can derive from them. It seems to be streaming fine for me here. Hi, Sanchita. Okay, Prerna, it's breaking. Yes, of course, Pooja. It's always difficult. That's purely memory based, right? So you have to note down and memorize. And with practice, it's possible. We have been doing this from our final year. So I don't find it really tough to remember these scientist names because we are used to it. But all of a sudden, definitely, if you're new to these names, definitely it's going to be tough, but it's not impossible. I'm just checking out my mobile also. It seems to be streaming fine for me here. I mean, both in my laptop as well as in my mobile. If in case you feel like it's breaking, try refreshing the page, or it's better if you can close and open the app once again, or you can just try closing the window and try reopening it again. The 3 hours is an MDS entrance lectures channel, so we'll be focusing more on the literature point of view rather than the clinical tips. We'll be discussing some clinical tips, but our main focus will be on the literature, like what different literature tells us and different techniques, or mainly academic standpoint. So that will be mainly our focus rather than clinical orientation. Okay then. Now, shall I proceed or do you want me to wait? Okay, Ramesh, it's fine for you, and Mega also. Okay, Neetu, glad to hear that. Yeah, right. Right. That way you can just check out my channel. We have a lot many videos over there. See if anything is useful for you, right? You can just check out the playlist endodontics. Right. So we have the step back technique. So step back technique, page 314. It's also called as conventional step back or telescopic technique. Telescope, we try to look at the far objects, right? So that's the reason why maybe since we are looking at the since we're trying to reach the far part of the canal, apical third is also called as telescopic technique. So conventional step back or telescopic technique. In this step back preparation of root canal, the canal is enlarged first in the apical third using the number 35 or number 30 instrument, and then each consecutively larger root canal instrument is used for shaping the middle third and the kernel part of the root, right? So instead of going through the entire literature, I'll just go through the important points, right? You can see the authors which we have discussed already. Coming to the concept of step back, as we have discussed, it involves preparation of the apical third initially, followed by middle and kernel third of canal using larger instrument sizes. And the sequence of instrumentation is we start with apical third, middle third, and then kernel third. And the recommended instruments are hand instruments. And the principal motion of instrumentation is we use reaming motion for kernel instrumentation and then circumferential filing motion for the apical third. And the advantages of this step back technique is its ability to prepare a proper apical stop prior to preparation of the middle third and kernel third of the root canal. And the limitations, this is very important. Extrusion of debris into periapex, tendency to straighten the canal, and loss of working length. And if you observe step down technique, which was proposed by Gorig et al., the concept is involves the preparation of kernel two thirds first, followed by preparation of middle third and apical third, and that's the sequence we follow. And recommended instruments are both hand as well as rotary instruments. And the principal motion of instrumentation is reaming motion, right? And the advantage is the shaping is easier since you're able to access the kernel third first. And elimination of bulk of the tissue, debris, and microorganisms from the kernel and middle third before the apical shaping. Thereby, it minimizes apical extrusion of debris, better access and control over apical enlarging instruments, and better penetration of irrigants. So these are some of the advantages we have with a crown down or a step down technique. And then we have this hybrid technique, and this involves a combination of crown down or a step back. And it is done in three phases: phase one, kernel third; phase two, apical third; and phase three, middle third. And we use recommended instruments are both, we can use even hand as well as rotary instruments for the same. And you know what? Initially, we go with kernel instrumentation using reaming motion and apical instrumentation using circumferential filing, which is similar to that of step back, which we have discussed now. The advantage is ability to shape the canal predictably, and it optimizes the advantages of both step back and crown down technique. However, when preparing middle third, care has to be taken in order to produce a uniformly shaped, funnel shaped canal. So that's been mentioned as the limitation for the hybrid technique, right? And regarding passive step back technique, which was proposed by Torabi and Aja. So normal step back technique, what do we do? As I said, assume that the working length of the canal is 25 mm. And till 25 working length, you have done cleaning till 35 size K file. So 25 mm working length, the master apical file is 35. In case of conventional step back, what do we do? With every 1 mm decrease in working length, like 24, 23, 22, we correspondingly increase the size of the K file, 35, 40, 45, 50, right? So, and in between we do this recapitulation, which you're all familiar with, right? So here we are following this 1 mm increment rule, where with every 1 mm decrease in working length, we are correspondingly increasing the size of the K file. So that's your conventional step back. But passive step back technique is that where we do not follow this rule, even though it's a step back. 25 mm, you use a 35 size K file, and you use a 40 size K file till where it goes, or as deep as it goes inside the canal, rather than following this 1 mm decrease in increment, right? I'll just go through the literature and see what you can understand. This technique, passive step back, was proposed by Torab and Nejad. It involves the insertion of a progressively larger hand instrument as deep as they can be passively placed. So we don't follow this 1 mm increment technique. We just place a larger file, 35K file, till your 25 size, 25 working length, right? So the working length is 25. So you use 35K file as your master apical file. And then you use the 40 size K file till where it goes passively, right? And you use a 45 size K file to the point where it goes passively. And you use a 50 size. So progressively larger K files till where they go passively and bind in the canal, right? So that's how we proceed with this passive step back technique. Hence it's called as passive, right? So we're not forcing the instrument till 1 mm short of working length, or 2 mm short of working length, or 3 mm short of working length. We're not forcing the instrument. We're just passively placing a progressively larger K instrument, right? Hence it's called as passive step back technique. I hope it's clear, right? So this technique was introduced by Torab and Ajar, and it involves the insertion of progressively larger hand instruments as deep as they can be passively placed. And subsequently, gates Leiden are used for additional kernel enlargement by apical instrumentation using this step back technique. And by the way, this GG is an obsolete concept now. We can refer modern concepts of endodontic access cavity preparation, which I have done previously, where I have discussed all the modern concepts. I have also discussed about the significance of pericervicular dentin, also why we shouldn't use gates Leiden, and how using them leads to perforation, or how using them decreases the critical PCD. And also I discussed many new concepts in that. You can just refer the video. I mean, it's there in the endodontic playlist. You can refer that, right? Modern concepts of access cavity preparation in case of your molars. Yes, it's like, yeah, even passive step back is a step back only. It's a step back pattern, but you're not following that 1 mm rule, right? You're just passively inserting the next larger file as deep as you can. That's it. Okay, fine. Now we'll proceed with other techniques. So that's your passive step back technique, which we haven't discussed that previously. And then, as we have been discussing about this crown down, pressureless, balanced force, etc., let me just go through some of the important points in crown down technique. So crown down technique, as I said, first initially any technique, we just try to establish patency. Patency is nothing but to see whether the canal is patent or open from the kernel third to the apical third without any blocks or without any calcifications, right? So patency is established using either 8 size file or 10 size file. Even this is very important. And then, as we have discussed, so we use 15 size to 25 size H file to clean the kernel third, and then we use GG drills, and then we use K files. K files progressively from larger file to a smaller file, from the middle third to the apical third till we reach the working length. That's how we proceed with crown down technique, right? Crown down pressureless technique given by Marshall and Papin, where we use Gates Glidden for early kernel flaring, and then we go with this pressureless technique. We call this a pressureless technique because when you're preparing the canal from the apical to from the middle to apical third, you're not applying any apical pressure. So straight K files are used. So initially in crown down pressureless technique proposed by Marshall and Papin, early kernel flaring is done with gate Glidden, and this is followed by incremental removal of dentin from the kernel to apical direction, and hence it's called as crown down. Straight K files are used in large to small sequence with a reaming motion and no apical pressure. This is very important. So in crown down pressureless technique, so in any crown down we are using this reaming motion, right? So we'll be using Gates Glidden initially, and then from the middle to apical third we use this straight K files without any apical pressure in reaming motion. Hence it's called as pressureless technique, crown down pressureless technique. And then double flare technique, as we have discussed, will proceed from kernel to apical third using K files, and then the reverse step back technique again. Hence it's called as double flare, proposed by Faber, FABV. And then most importantly, we have something called as balanced force technique. So what is this balanced force technique? As I said, it was proposed by Ronne and Sabala. We use Ronne files, K-flex files, where the cutting tip of the file has been modified to make it more self-centered. Usually when you have a cutting tip angle of 75 plus or minus 15 degrees, it is very sharp, and you can just go and gauze into the canal, right? So there can be ledge formation, there can be transportation, right? So to overcome that, the cutting tip has been modified or has been reduced so that the canal remains centered. So reducing the cutting tip, the canal remains centered comparatively, and there is minimal chance for canal transportation or ledge formation. That's the rationale behind using this flexor files. And flexor files, right? Flexor files or even flexo files. So in this balanced force technique, it's clearly mentioned that we preload the instrument inside the canal in a clockwise direction, not exceeding 90 degrees, and then maintaining the same pressure, we try to rotate the instrument counterclockwise 180 to 270 degree, where you will have this characteristic clicking sound because of fracture of dentinal shavings, right? So that's how this technique is performed. It's mentioned that when you're trying to rotate your instrument clockwise, preloading the instrument clockwise 90 degree, and when you're trying to rotate it anti-clockwise, it tends to come out. So in order to prevent that from popping out or from coming out, we have to maintain that apical pressure and then turn it anti-clockwise 180 to 270 degrees, right? So this is balanced force technique, and it's done using your flexor files or even flexo files, and different file systems and instruments cross sections were discussed in detail in one of the previous videos. You can check out that for more information. So balanced force technique, kernel enlargement is done with GG drills number 2 and 3, and middle to apical shaping with flexor files up to the working length using this balanced force technique, right? And then the advantages of crown down techniques is to be discussed. This is very important because crown down technique, you're trying to eliminate as much as infection as possible from the kernel to middle thirds. Shaping of canal is subjectively easier than step back technique. The removal of kernel obstruction allows removal of bulk of the tissue, debris, and microbes before apical cleaning. This technique minimizes extrusion of debris through apical foramen, thereby preventing post-op discomfort, and it allows better access and control over the apical enlarging instrument, thus decreasing the incidence of jipping. So when you're trying to remove kernel middle third first, so the moment you're trying to clean the apical third, there is no hindrance from the kernel or middle third, right? So all this you can easily visualize once you do some root canals. It's really difficult to visualize from the text itself, but once you're used to it, then it will be a very simplified process for you. And most importantly, this crown down technique allows better penetrability or penetration of the recants. As I said, the concept is now shaping for sake of cleaning, right? Ultimately, you should be able to disinfect your apical third of the canal to ensure post-op success, right? And working length is less likely to change while employing this technique. So all these are advantages we have with this crown down technique, right? I hope it's clear. Now, hybrid technique. So hybrid technique is a combination of both step back and crown down. So I'll just go through this hybrid technique where you have this flowchart given here, right? So hybrid technique, initially we achieve patency using a number 10 size file or K size file. And then, as I said, first, if you remember hybrid technique, first phase, kernel third cleaning, second phase, apical third cleaning, and third phase is middle third cleaning. So we'll start with passive pressureless placement of sequential sizes of 15, 20, 25K files to the point of canal binding. And then we kernelly pre-enlarge with gates hidden in the sequence number 3, 2, and 1. And then you establish working length. So what we're trying to do here is in hybrid technique, we're trying to clean the kernel third, establish the working length, and then placement of size 40 or smaller K file to the point of canal binding and enlarging the working length. So that's how we proceed. So once this kernel enlargement is done, once this working length is established, then we proceed with step back instrumentation, right? So enlarging the working length from size 15 to recommended master apical file sizes, and then canal preparation is done with a sequential use of progressive larger instruments, and that's the same. And this step back procedure is performed until the middle third to obtain a continuous tapering canal preparation shape. So I need not go into the details of this technique again because it's the same. So initially we have this crown down technique and then we have this step back technique. It seems to be similar to that of double flat technique, but it's been mentioned in specific with a protocol. So we follow this protocol, we call this as hybrid technique, and this hybrid technique is proposed by the same authors, which we are referring now, right? So advantages of hybrid technique: ability to shape the canal predictably as we have discussed previously and optimize the advantages of both crown down and step back technique, right? So that's the reason why it's mentioned as step back. And you did not really worry about this sequence because a sequence for each technique do vary, but try to have this overall picture and most importantly try to focus on few techniques. So hybrid technique, I think if you get the overview, that would be more than sufficient. So focus on crown down techniques in specific, focus on this balanced force technique, right? So you just have an overview, that would be more than sufficient, and you have these flowcharts given in your latest edition of Crossman, and that would be more than sufficient, right? And also try to understand and rationally try to follow why we have crown down technique or why crown down technique is superior compared to a step back technique, right? And also, I would like to briefly go through the recommended master apical file sizes. Okay, it's given in 1310, table 1310, where they have mentioned the recommended master apical file sizes for each tooth. It's obvious that in case of anterior tooth, we have to use a larger file in order to reach the apex, right? Because the canals are much more bulkier and larger. But as we move on posteriorly, right? So the canals are narrower, right? So master apical file size decrease as we move on posteriorly. So in case of central incisor, for maxillary teeth and mandibular teeth. So first we'll deal with maxillary teeth, right? Maxillary central incisors, the recommended master apical file size is 50 to 70. It depends again on the shape of the canal, right? Or the size of the canal. 50 to 70 central incisors, 45 to 60 lateral incisors, 45 to 60 canines, 25 to 40 premolars, and in case of molars, mesobuccal and distobuccal, it's 25 to 40, and palatal, it's more larger, so 30 to 50. So the size of the file can be between these ranges. So the ranges have been mentioned here. So that's the common standardized protocol which we follow, right? So I'll just repeat that again. Maxillary teeth, central incisors 50 to 70, lateral incisors 45 to 60, canines also 45 to 60. So laterals and canines the same. Premolars 25 to 40. So premolars and molars the same, 25 to 40, except for the palatal root of maxillary molars where it is 30 to 50. That's it. Now coming to mandibular teeth. Central incisors 25 to 40, laterals also the same, 25 to 40, and then canines and premolars are the same, 30 to 50. Molars 25 to 40, right? And in case of molars, the distal canal is larger, so it's recommended the same again, 25 to 40. So in case of mandibular teeth, mandibular molars especially, it's 25 to 40 for all the canals. The recommended master apical file sizes, right? So this is in brief the recommended master apical file sizes. It's better if you can memorize them, right? So can be asked as a question also. Anyways, we'll have a lot many MCQs discussion from the same topic. We'll have that MCQ discussion tomorrow, right? I'll frame more and more questions for you, and we shall have discussion tomorrow regarding the same topic. Only the MCQ discussion, and then we'll proceed with tomorrow's virtual classroom session as usual, right? So I hope it's clear. You have any questions, you can drop them, and I'll try answering them, right? Okay. There is no comparative, Pooja, there is no comparative analysis of passive step back with apical extrusion. Obviously, we can expect the same. We can expect the reverse of what you're saying. In passive step back, there is more chance of apical extrusion. I don't think so. It's the reverse. In passive step back, you have less chance of apical extrusion because you're not intentionally going till your working length or 1 mm short of working length or 2 mm short of working length or 3 mm short of working length. You're not intentionally pushing your instrument. But passive step back, you're just placing the instrument as deep as you can till it passively engages into your root canal dentin, right? So the chances of apical extrusion would be obviously be less in case of passive step back than your conventional step back technique. I hope it's clear, Pooja. Balanced force technique. Balanced force technique is nothing but you're preloading the instrument. You place the instrument inside a canal, you place it inside a canal, and then rotate it 90-degree clockwise, right? And then you rotate it 180 to 270-degree anti-clockwise, maintaining the apical pressure. I mean, not just pushing it intentionally, but once you rotate an instrument and try to move it in a counterclockwise, the instrument comes out slowly. So to prevent the instrument from coming out, you have to maintain the apical pressure and then try to rotate it anti-clockwise 180 to 270 degree using your flexor files, right? K-flex files, you have this flexor files and also you have this flexo files, different modifications of K files which we had discussed previously, right? Yes, Prithvi, you can refer Grossman. Jipping is nothing but a surface morphology modification, which is iatrogenically induced because of damage to the apical third of the canal on the inside of the curvature. Anyways, mishaps of endodontics, we'll discuss that again separately, right? So jipping, canal transportation, so all these are nothing but iatrogenically induced issues in our root canals. Yes, Devna, it's breaking still. We're not dealing with rotary instruments here. We're only dealing with instrumentation techniques. All that we have discussed now, Pragati, that's what we follow clinically, right? We have this step creation. To remove that step creation, we again do circumferential filing. We again do this, what do you call that? Recapitulation to remove all those steps. Obviously, when you try to, in case of your step back, when you're decreasing the working length and increasing the size of your K file, obviously step creation is same. And finally, you have this circumferential filing till your working length so that you create a uniformly tapered instrument, right? Uniformly tapered canal. So we have this step creation possible clinically. I hope I've answered your query. Canal transportation is nothing but you're changing the normal course of a canal. If a canal is curved, if you make it straightened, then that's called as canal transportation. Jipping is on localized phenomena where you have this elbow, where you have these names given to that particular area where the inside of the curvature is removed more excessively. So we have this localized phenomena which is called as jipping, which is completely different from canal transportation. When you follow step back, steps are created And to remove those steps, we are using circumferential filing, and we are using circumferential filing till your working length using your files. Okay, we'll do one thing. So all these iatrogenically induced problems or damages in your root canal will have a separate session, right? Transportation, ledging, or I'll do one recorded video on this. I'm actually planning to do one. So canal transportation, jipping, and ledging, we'll discuss that separately. So you have any questions pertaining to these instrumentation techniques, do let me know, because tomorrow we'll have MCQ discussion. We'll have 10 to 15 MCQs exclusively from the topic. Yes, definitely. We will have a recorded video with all the illustrations possible. Ledge is nothing but a step, an unwanted step, which prevents you from reaching the apical third of your canal. Yeah, we'll have a detailed discussion regarding this, what is iatrogenically induced errors in your root canal. We'll have a recorded video, right? Yeah. The challenge we have with this topic is, for us to understand this topic efficiently, we should be able to practice it at least once. At least once you do a root canal, or at least on an extracted tooth, then you can visualize what actually we have been discussing. Or else it will be quite challenging for you to correlate that clinically or to visualize what we have been discussing. Crown down and step back completes your entire topic, right? And where is the rest here? Yes, Prithvi. I'm already planning that. Image-based discussion will have those images, cross-sectional images, and we'll have some discussion. We have only one hybrid technique, right? And also it's been simplified in your textbook. Yeah, try to focus on step back and crown down. That would be sufficient. Just have an overview. You need not really go into the details, but you should have an overview and the names of the scientists who proposed them, and a brief overview of the entire procedure, like what exactly you're doing, like which file system you're using, how you're proceeding from the kernel to apical third, and also like how exactly is that clinically relevant, like what are the advantages, the disadvantages of crown down over step back and vice versa, right? That's it. I think Prithvi is talking about the cross section of the rotary files. So we have separate cross section. I mean, the topic on these rotary files, we'll have a separate discussion on that, right? Yeah, obviously we're having this image-based discussion this Friday. I'll incorporate this. All the rotary instrument cross sections, and also I think we have already discussed about these landmarks of a file, right? So I think I've discussed about this land, helix angle, pitch. I'm not exactly sure. I'm just cross-checking. I think we have that video in our e-classes also. Mm. Components of endodontic file, I think I've covered the same in this video. Yes. You can just refer components of endodontic file. We try to cover all the parts of an endodontic instrument, and image-based discussion will have a continuity of the same, right? We'll try to discuss various systems that are available. So to understand that image-based discussion pertaining to these cross sections, we should have an overview of all the components of a file. Then you can easily correlate. Yeah, components of file, Preeti. Thank you. Yes. Previously, Benis, we discussed only about the hand instruments, files, reamers, H files, and also brooches, right? Only hand operated instruments were discussed in detail. Okay, yes, Preeti, glad to hear that. Yeah, it's Trophy which is shouting outside. Yes, Prerna, hand instrument discussion is different again. I mean, we're done with, yeah, I think you're talking about the virtual classroom. Yeah, right. Yes, teeth models for embryonic practice are available, right? Yeah. Yes, yeah, go through that video once, components of an endodontic file, so that when you're discussing this cross section, we have these terms, helix angle, land, and all this terminology is coming up, propping up there, right? So we'll have much more clarity. So we'll have the discussion this Friday again. Okay, I hope it's clear what we have discussed so far. It's quite simple, but the thing is, at least if you have done that previously, at least one step back technique, then it will be much more easier for you to visualize all that we have been discussing so far. And also check out the video. I mean, e-classes, maybe in another 1 hour or so, I'll just upload this video on functional motions of instrumentation, right? Okay. You have any further questions? Do let me know, or else we'll just stop. We've been having these holidays for the past 4 or 5 days, and it's been really very boring, to say frankly. The moment you have holidays, we feel like we can do a lot more, but the reverse often happens. We tend to relax more, and there is a lot of wastage of time as well. Only when you're occupied with some work every day. So that's the reason why I often feel that whenever we have college, I mean, we feel irritated to go to college every day. But the importance of having college every day, one can realize when you're having your holidays, like when you have 20, 25 days, or after your exams, you have these holidays at a stretch. Don't you think it's really boring? So only once you have some kind of activity every day, it really helps you sustain your passion or sustain your process of working, or else it will be too boring, or else it will be too passive, and it doesn't really have this essence, right? Yeah, procedural errors we'll definitely discuss, Pragati. We'll have a separate session. We'll have a recorded video on that, right? Because this week, all live sessions, we have already scheduled them. We have this timetable. So we'll be following the same. So what are all the additional topics you tell me? We'll try to cover them in our e-classes. So in fact, extracted teeth, it's not officially acceptable or legal to buy because these come under human anatomic waste, right? So you'll have some legal issues and you can't buy them officially. So obviously in India, as we said, we get that from a clinic or from a hospital. And there are few clinicians who even sell extracted teeth. And it's unfortunate that I had to buy one extracted teeth for around 75 rupees or 85 rupees during my thesis work, or I think it's during my short study in PG. I had to buy extracted teeth. I never bought any extracted teeth all 7 years or 6 years, but for the first time, I had to buy each tooth, and I had to buy like the 30 or 25 teeth. So just imagine a student putting around 800 to 1000 rupees to just buy extracted teeth. So the world is in such a way that we're trying to make money out of everything possible. We are leaving no stone unturned. Yes, back to college tomorrow. You welcome Pooja. Yes, Pragati. It will be mostly be lazy. Because I never conduct this official kind of class. If I start saying that I'll give you attendance only if I put on these rules, like only if you come to my class I'll give you access to my classes, or only once you come to my class I'll answer your queries, or if you don't come to my class I'm going to punish you. If I am going to frame these kind of rules, then obviously no one is going to enjoy, right? So maybe that's the reason why you like attending my classes. Yes, Regina. I spent almost 75 to 85 rupees per tooth. I mean, there are people who even spend more. Exactly, Jenna, that's what happens. You have to buy it in black if necessary. I think, but you'll not be allowed to transport them through flight, or I don't think that will be acceptable, Regina. Pooja, you feel fresh after attending live sessions. Glad to hear that. That's what I've been focusing today. Even today, we had one general question. Hey, Toffee, come on. Hey, 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 yeah. Even today, we had this general discussion, right? So I said, I made one video on power of optimism. So it's not just about doing things, it's like how we are doing it. So enjoying while simultaneously doing will definitely sustain that activity. If you're just doing it for formality's sake, then obviously you're not going to sustain that activity for a longer time, and there won't be any life in what you're doing. It'll be just passive, numb, and very much irritating. So obviously, the objective of my live session, or what we have been trying to do from our side, is to create that enthusiasm and energy, and to have that lively feeling, so that we simultaneously learn and enjoy. Because once you learn by enjoying, learn by feeling relaxed, learn by understanding the importance of what we are learning, then obviously we're going to have more confidence, and obviously we're going to grasp more, even better. So I think we're trying to do that for the past couple of months, and I'm not sure how successful we have been so far. But obviously, the response from you guys, like just now, as Pooja said, like feel refreshed, and few of you wait for the live session, and this definitely is a positive sign for what we have been doing. And thank you so much for all your support. Okay, Prithvi, glad to hear that, and thank you for your compliment. Sorry, Regina, what was that morning mail? I understood how difficult to be on your place. I even feel ashamed to mail you. Why? Yeah, obviously that's the reason why I said I've even posted one bulk mail to every one of you regarding this doubt clarification, because often I've been getting doubts, like they'll just, I mean, I'm not blaming anyone here, but yes, I do know, I do understand your situation. You want an answer for one question, you take a pic and mail me. That's fine from your side. But the issue which I'm facing is, just imagine how many mails I'll be getting in that process. And okay, let me just try answering all those mails. And obviously, I have to stop all my work. I'm just telling you some practical difficulties, frankly. So I have to stop all my work. I have to clear off all the mails. It takes at least 3 to 4 hours every day exclusively on mails. I have only 8 to 10 hours to allot for what I have been doing. So if bulk of my time is lost in solving these MCQs, I mean, if the question is genuine, or if you feel like you need clarification, then that would be much more beneficial to you as well as for me, for every one of us. But most of the questions are like, they're very simple. In fact, I'll be getting most of the questions which are very simple. So I'll be just wasting time answering those simple questions, and what benefit would you be deriving from me? So that's my point there. So if you find that a question is challenging, or if you haven't understood the concept, and most importantly, if you haven't found that anywhere else in any standard textbook given, mentioned in one of the mails, then it's better you approach me. That way, as I said, you'll be deriving maximum benefit from my side as well. and also saves time, not only for me, but also to you. You might ask me how. Because you just drop mails, obviously I'm going to take more time clearing all of them, and it delays the process for you as well. You'll be getting mails too late, obviously. So that's the reason why I mentioned that you need any clarification, or you want any clarification from a topic, or you don't find that concept in any standard textbook mentioned, then obviously I'll definitely help. We have the standard reference articles, PubMed index, we can refer them, and I'll definitely give you. And till date, I'm quite sure that I've answered more than 98 to 99% of all the mails. One or two mails I might have missed, I agree, but around 98 to 99% of the mails I answer them within 24 hours. But as we're progressing, the number of mails have been increasing drastically, and most of the times I get a mail where there is not even a sentence or line or even hi. I'll just get a screenshot, or I'll just get a photo, like with the subject doubts. So these things really slow me down. So I was literally frustrated. So that's the reason why I had to create a draft, and I don't know how many were hurt by that, but I had to post them to every one of you. So in that I mentioned the same, right? You need any clarification, you don't understand the content, then I would be the happiest person to explain you. But those kind of information which you can easily retrieve from a standard textbook, there is no point in asking me, right? If you ask me, if you feel like I'll give you a ready-made answer, in fact, I'm doing more harm to you rather than good. You can ask me why. If I give you a ready-made answer, then who is thinking? Who is searching for answer? Who is referring answer? Who is understanding answer? It's me, it's not you. So if you can refer, if you can find out the answer by yourself, then when you apply, when you have that focus, when you really, I'm not sure how much I'm able to pass on what I'm trying to say, but only when you put that effort personally in opening the textbook, searching the answer, and writing down the answer, then you're going to get that registered in your brain forever, at least till your exam. Or you might ask me, just give us answers, we'll just memorize. Okay, good. You'll memorize the answer only for now. What about thousands of MCQs which you'll be facing every day, or at least over a period of months together? Do you think you'll remember all the answers for your MCQs? Now, I know that you all have good memory, but why should you do all that? I mean, it will be more confusing, and there is a greater chance for you to commit an error. And most importantly, if I directly give you an answer, what if the question is twisted? Don't expect the same question. You will never have the same question in any exam. You'll always have different questions. What if the question is twisted? You'll land yourself in soup, right? So my point here is, you put the effort in searching the answer from a standard book. If you don't find that in a standard book, get back to me. If you have no clarity over the concept, get back to me. I'm here to help you in those contexts. But if you expect me to give an answer for each question, so obviously that's the challenge we have. It's waste of time for both of us, and most importantly, you're not going to learn in this process. This I'm telling you frankly. I'm not trying to escape, I'm not trying to reduce my work. Frankly speaking, I have a lot of work to do. And in spite of all of this, I've been trying replying mails, and if at all, if no one is satisfied with this process of learning, just let me know. We'll see how better we can do it, right? Suggestions are always welcome. Yes, Regina, by the way, thank you for bringing that to my notice. And by the way, I didn't get you when you said like after your morning mail. I mean, what did I mail you this morning? When you got all extracted teeth for 100, then you're definitely smart than me. I bought each tooth for 65 to 70 rupees. Yes, Bernice, you loved my video on optimism. Glad to hear that. And I had to drink water, not once, but twice or thrice. Because there was some issue in recording, so I had to re-record the video 2 or 3 times. So I had to drink that half glass of water 2 or 3 times. Yes, Prerna. Yes, Toffee seems to be tight. It's been playing. I mean, it's been playing since morning. But now it doesn't relax. It stays active till 2 a.m. and 3 a.m. possible. And then morning and all, it will be sleeping. And nighttime, it will make sure that we don't sleep. She will make sure that we don't sleep. Right? So you have anything to share, do let me know. I'll just wait for a few more minutes. Okay, by the way, Ashina, how is your network going on? Okay, I mean, when you upload that to YouTube, you have this automatic, what do you call the thumbnails being generated. So I have intentionally selected that picture with drinking a glass, drinking water using glass. Right. So we'll break them. So it's already 10:50. So they can sleep early, at least by 11:30. Wake up early in the morning. So as we have been discussing in your group also, in our group also, like morning group, 4 a.m. to 8 a.m. or at least 5 a.m. to 8 a.m. is the best time to grasp the concepts or go through the memory based topics, right? So try making maximum use of them. Of late I've been trying to do, but there have been I'm unable to cope up. So I'll be trying following the same from tomorrow. I'll try wake up at 4:30 or 5 and see that I can make maximum use of the early hours. It's very, very important. It's very fresh, and I hope you are all trying to follow the same, right? I see the moment I wake up, I see firms from 500 or 600 messages in our morning group, and it's next to impossible for me to go through the messages also. Yes, Prithvi, don't worry, you're going to have need for sure. I'm not exactly sure. Maybe because of change in pattern, maybe some discussions going on, or maybe some background work going on. So maybe they haven't announced it till date, right? Anyways, as I said, don't worry regarding the dates. So you can just leave it to me. It's my headache. It's my responsibility. So I'll let you know the moment they're announced, right? But I'm not really sure like why it's been late so far. Right. So I guess we'll stop here. We'll again see you tomorrow. We'll start tomorrow if possible early by 8:30 or 8:15 so that we can have some MCQ discussion on the same topic like this crown down or step back techniques or various root canal instrumentation techniques. I'll let you know through WhatsApp update group. And then we'll go ahead with tomorrow's virtual classroom discussion, various clinical diagnostic aids in endodontics. Okay then. So it's again a great session for me. It's always pleasure interacting with all of you. And see you tomorrow live. I'll let you know the time. It's 9 for sure, but we'll see if I can start a session before 8 or 8:15 so that we can have this 40-minute MCQ discussion as well. Okay? Yes, thank you, Pragati, for your compliment. I'll take it as a compliment, right? And definitely it's possible. It's not just a one-man show, isn't it? It's not just a one-man show. It's possible because of a combined effort. As I said, optimism in today's video, it's not just possible because of one person. It's a teamwork. It's teamwork which is making it possible, and it's the support from you people that makes all of this feasible and practically feasible, right? So wish you all the best again. Good night. Take care. I love you all. See you tomorrow. Right? Bye.